Health Matters with Paul Rosen.
If you're not getting any relief or not finding any forward momentum in your path to trying to get back to health, I would suggest you go and look into muscle response testing. Go see Paul.
It's a life-changing. You feel so much better. It's priceless.
Straight talk about health with your host, Paul Rosen.
Over 131 million Americans can't be wrong, or can they? According to one estimate, it's 131 million Americans, or 66% of all adults in the United States who use a prescription drug. Is that a good thing or a bad thing? We'll find out this morning on Health Matters with Paul Rosen. What do you think, Paul? That's a lot of Americans taking drugs.
A person who smarter than myself, definitely.
Well, thank you. Oh, no, you're talking about somebody else.
Oh,
sorry.
Gosh.
Okay.
Once said that it is an impossibility to replace poison, to replace the outcome of nutritional deficiencies with poison. It makes no sense. There are absolutely appropriate times to use prescription medications. Don't have time in a 1-hour show to go through all of them, but the bottom line is I absolutely will direct my own patients to a Western medical doctor when the time is appropriate. Also, with respect to acute life-saving health care, nobody does it better than Western medicine. Where the gap lies is where, unfortunately, most people find themselves in ill health, and that is functional illness.
What do you mean by that, functional illness?
Where their bodies are not functioning properly. An example of that would be high blood pressure or low blood pressure.
So a number of common ailments.
Insomnia, migraines, all kinds of digestive problems.
So as opposed to very serious conditions, these are, as you say, functional illnesses, which are very common. Is that right?
If you ignore them, they become serious conditions. If you don't do anything about them, they become serious conditions. If you decide to use prescription medications, they become serious conditions because prescription medications do not and will not ever be able to treat the root cause of the functional illness, at least at this stage.
Treating symptoms, not causes. That's
correct.
What we're doing, right?
So what happens is that prescription medications basically suppress the symptom, and in doing so, create the environment for you to experience side effects. That's what lack of root cause addressing therapies result in, is in side effects. And the term side effects make it seem, or at least they've been interpreted to be, these kind of very small, relatively benign symptoms that a person would experience when, in fact, oftentimes they're life quality destroying.
I can see that because almost any ad for prescription medications, especially television and radio ads, will include long disclaimers at the end of the announcement. And basically those amount to you may experience side effects. However, as you're indicating, that may be beyond saying having a simple rash or a little bit of nausea. You can have longer-term, more health-destroying side effects.
And another point is that we essentially eat our way into these chronic functional conditions.
Well, to back up a bit before we get to that point, I think many of us, if we get temporary relief from whatever these functional illnesses are, for example, migraines, if you take a prescription and suddenly you don't have a headache anymore, that to you is going to seem like a success, right?
Yeah. But it's fool's gold.
Agreed. So we kind of have to make that mental leap from that temporary relief, which, as you say, is just suppressing a symptom, as opposed to a longer-term cure for our problems.
The other introductory concept or background information that I want to make sure I get out before I forget it And that is my viewpoint on this, comes from clinical experience. It comes from getting people off of medications, which is, my specialty. It's one of the things that I have been able to accomplish over the almost 30 years of experience in this field of, nutritional transformations. And that includes cholesterol issues, it includes high blood pressure issues, it includes diabetes, it includes migraine, it includes thyroid complications, hormone replacement issues, digestive issues of all sorts, excess acidic or conditions. Oh my gosh, whenever I start making the list, my mind kind of goes blank because there are so many situations that are addressed or trying to be addressed by prescription medications. If you're taking a medication and you would prefer not to live with the side effects or the anxiety of the potential side effects, then it is absolutely worth taking advantage of a nutritional evaluation to determine whether or not the nutritional approach will be effective. And the one thing that I tell all my patients is that I won't take them on as a patient unless I can help.
Do you first have to make everybody understand that there is a connection between a functional illness such as migraines and your nutrition? That's not necessarily a leap I would make.
So let's just take an example. It's kind of a good lead in. Let's take an example. So acid reflux, to begin with. Acid reflux, to a great degree, the symptoms of acid reflux are basically reflected in vitamin B deficiencies, in particular vitamin B1, which is responsible. Vitamin B1 has a lot to do with the production of hydrochloric acid in your stomach. Now, the misunderstanding of acid reflux, in fact, of the whole medical community, in my view, is that the acid reflux condition is not due to excessive hydrochloric acid production. It's due to deficient hydrochloric acid production, and the burning feeling that you get is the rotting food in your gut that's not being sufficiently metabolized, processed, broken down.
Does acid reflux manifest in your mouth mostly, or from what you're saying,
gut.
It sounds like your gut? Okay.
Yeah, your gut.
But would it also?
It'll
it
feel
sounds
like
to me
you have a burning in your chest or in your upper abdomen.
And not to get too specific, but does it involve maybe bile in your throat or anything like that?
That would be a gallbladder dysfunction.
Okay, that's
so
something.
that bitter taste when you belch, that bitter taste that you might get is a gallbladder issue. The burning or the acidic flavor that you might get, that can be from stomach content. Yeah.
So that I follow, but how can this be a symptom of not enough hydrochloric acid? Because immediately, based on everything you're saying, we're thinking, well, I've got too much acid. I need to get rid of that, and I'll get rid of the nausea.
Because if the food isn't digested properly, if it's not broken down with the appropriate amount of hydrochloric acid, it will spoil. It will rot in your gut.
So you need the proper
and
amount.
And that will lay against the membrane of the stomach and ultimately create an inflammatory condition.
What does vitamin B1 then have to do with the amount of hydrochloric acid?
That's exactly what it has to do with.
It
it's one of the things.
It manufactures more?
It is a part of the necessary material in order to help the hydrochloric acid producing equipment in your gut.
Okay, that
do
makes
its
sense.
thing.
So vitamin B1 can be inputted into our bodies, I assume, through food. In other words, food is a source of vitamin B1.
You see, he is, without a doubt. I mean, I pay him for that, which is even better. Other examples of vitamin B1 deficiency, the symptoms that you're experiencing: chronic fatigue and apathy or lethargy, irritability, drowsiness, blue moods, poor concentration, depression, which is an extension or a severity of blue moods, anorexia, nausea, vomiting, abdominal pain. This is another interesting symptom. Paresthesia, numbness and tingling in the extremities or various parts of your body. Peripheral neuropathy is another term where you're getting some, neural anomalies in your extremities. Depressed tendon reflexes, loss of vibration sense, tender muscles, weakened leg muscles, muscle cramps, and even congestive heart failure over time. Do you know what all of these symptoms reflect?
A lack of vitamin B1.
Beriberi is the
technical term.
label for this grouping of symptoms. Beriberi.
So beyond these symptoms, is there a way to measure your level of vitamin B1?
There is. Measuring vitamins is a very inexact science, but worse than that, it doesn't tell you what your stores of some of these vitamins are in various parts of your body. It only tells you what's in your blood.
Yeah, I wouldn't think
this is a total deficiency of, doesn't get you where you need to be. In other words, you could be deficient of B1, experiencing some of these symptoms, perhaps not the severest of them, and never know that you had a vitamin B deficiency, B1 deficiency, until someone like myself goes, you should be taking Cataplex B from Standard Process, along with you need to change your diet, and then we need to address the environmental issues, and all of a sudden the symptoms just disappear.
Our supplements.
So let me say this, and this is important, because some smart aleck will come back to me and go, well, correlation is not causation. And I'm okay with that. But let's call it the way it is. If I'm taking these actions and the symptoms disappear, does the patient care whether it's correlation or causation?
Probably not, no.
Probably not. And furthermore, them being able to get off of their prescription medication, does the patient care whether it's correlation or causation?
Of course not.
Of course not. Do it once? Lucky guess. Do it 150 times? Do it 1,000 times? Not so much.
So here's the bottom line. If you have a vitamin B1 deficiency, for example, this nutritional and supplemental means of getting that vitamin is far preferable to prescription medications where you run the risk of bad side effects and all the expense and hassle of that. Why not get what you need in a healthier manner?
Acid reflux medications from over-the-counter to prescription will absolutely guarantee you side effects of the nature that you would prefer not to experience, and never treat the root cause, ever. Some other symptoms of beriberi or vitamin B1 deficiency: appetite loss. Can't tell you how many people come in with these digestive symptoms, for example, and have appetite loss along with it. We already talked about tiredness and irritability, muscle aches and pains that come and go, and muscle cramps that are often addressed by either additional magnesium supplementation or the use of sour tasting liquids or foods. Right? These are not conditions that require poison to address or to fix. Swollen joints, paralysis we talked about, and various types of heart problems. It's interesting to see the symptoms, because the symptoms are the symptoms, and the body only has a limited number of ways it can tell you it's upset, right? And it's interesting to see the at least the correlation between the symptoms that people are experiencing that are for which they are given prescription medications and the nutritional deficiencies. It's very interesting. And how do I deal with this? As I said, I get people off these medications all the time. And interestingly enough, one of the destructors of vitamin B1 in the body, I know you can guess this one.
One of the destructors?
Food destructors.
One of the things that actually destroys
B1.
The amount of B1 in your body, I'm going to guess, is sugar.
There you go.
Which destroys so many other good things in your body.
See that, folks? He has been listening.
There you go. Even though Paul noticed I had a magazine open over here while we were doing the show.
With a latte and 3 tablespoons of sugar.